Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhita. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Alopecia areata. Alopecia areata is one type of hair loss that typically causes patches of baldness. In some cases, total baldness develops. In many cases, the hair regrows, typically after several months. In some cases, the hair loss is permanent. Treatment includes panchakarma, the purification regimen, and person-specific traditional Ayurvedic drugs. These are prescribed basing on your constitution and pulse examination. What is alopecia areata and who is affected? Alopecia means loss of hair or baldness. There are several different causes and patterns of alopecia. Alopecia areata is one type of hair loss. Estimates of the number of people affected vary between 1 in 1,000 to 2 in 100 at some point in their life. Alopecia areata can occur at any age, but most cases first develop in teenagers and children. In about 6 in 10 cases, the first patch of hair loss develops before the age of 20 years. Males and females are equally affected in younger age groups, but those affected later on are mainly women. The condition tends to be milder when it first develops at an older age. What are the symptoms of alopecia areata? The typical pattern is for one or more bald patches to appear on the scalp. These tend to be round in shape, and about the size of a large coin. They develop quite quickly. A relative, friend, or hairdresser may be the first person to notice the bald patch or patches. Apart from the bald patch or patches, the scalp usually looks healthy and there is no scarring. Occasionally, there is some mild redness, mild scaling, mild burning, or a slightly itchy feeling on the bald patches. When a bald patch first develops, it is difficult to predict how it will progress. The following are the main ways it may progress. Quite often the bald patch or patches regrow hair within a few months. If hair grows back, it may not have its usual color at first and look gray or white for a while. The usual color eventually returns after several months. Sometimes one or more bald patches develop a few weeks after the first one. Sometimes the first bald patch is regrowing hair whilst a new bald patch is developing. It can then appear as if small bald patches rotate around different areas of the scalp over time. Sometimes several small bald patches develop and merge into a larger bald area. Patches of body hair, beard, eyebrows, or eyelashes may be affected in some cases. Large bald patches develop in some people. Some people lose all their scalp hair. This is called alopecia totalis. In a small number of cases, all scalp hair, body hair, beard, eyebrows, and eyelashes are lost. This is called alopecia universalis. The nails are affected in about 1 in 5 cases and can become pitted or ridged. Some people become self-conscious, anxious or distressed by the appearance of the hair loss. What causes alopecia areata? Alopecia areata is thought to be an autoimmune disease. The immune system makes white blood cells, lymphocytes, and antibodies to protect against foreign objects such as bacteria, viruses, and other germs. In autoimmune disease, the immune system mistakes part or parts of the body as foreign. In people with alopecia areata, many white blood cells gather around the affected hair roots, hair follicles, which are mistaken as foreign. This causes some mild inflammation which leads in some way to hairs becoming weak and falling out to cause the bald patches. It is not known why it is common for only certain areas of the scalp to be affected. Also, the affected hair follicles are not destroyed. Affected hair follicles are capable of making normal hair again if the immune reaction goes and the situation returns to normal. It is not known why alopecia areata or other autoimmune diseases occur. It is thought that something triggers the immune system to react against one or more of the body's own tissues. Possible triggers include viruses, infection, medicines, or other environmental factors. There is also an inherited factor which makes some people more prone to autoimmune diseases. About 1 in 4 people with alopecia areata have a close relative who is also affected. If you have alopecia areata, you also have a slightly higher than average chance of developing other autoimmune diseases such as thyroid disorders, pernicious anemia and vitiligo. However, it is important to stress that most people with alopecia areata do not develop any of these other conditions. Do I need any tests? Usually not. The diagnosis is usually based on the typical appearance of the bald patches. If there is doubt about the cause of the hair loss, sometimes some blood tests or a skin scraping from a bald patch may be done to rule out other causes of baldness. A small skin biopsy, small sample, is sometimes taken to look at under the microscope. What is the outlook, prognosis, for people with alopecia areata? Mild cases of alopecia areata often get better without treatment within a few months to a year. In some cases, patchy baldness may come and go over many months or years. The size of the bald patch or patches and how long they last are quite variable. If less than half of the scalp is affected and no treatment is started, there is about an 8 in 10 chance of full hair regrowth within 1 year. With more extensive hair loss, it is less likely that hair will regrow. However, even if your hair grows back fully after an episode of alopecia areata, it is common to have 1 or more recurrences of the condition throughout your life. About 1 in 5 people who develop alopecia areata will progress to alopecia totalis, total scalp baldness, and about 1 in 10 will develop alopecia universalis, loss of all scalp and body hair. Progression to these more extensive types of hair loss is more common if the onset occurs in childhood. The initial bout of hair loss affects more than half of your scalp. You have Down's syndrome. You have atopic eczema. You have eyelash and or eyebrow hair loss. You have a family history of alopecia areata. You have aphiasis, alopecia areata of the scalp margin. You have nail changes. You have another autoimmune disease. Treatment can promote hair regrowth in some cases. What are the treatment options for alopecia areata? Not treating is a common option. Alopecia areata is a very unpredictable condition. In many cases, bald patches regrow by themselves without treatment. In particular, if there are just 1 or 2 small bald patches, you are advised that you simply leave it alone at first. This is sometimes called watchful waiting. If the hair loss is not too bad, then there is a good chance that your hair will regrow after several months. Any regrowth usually does not start within 3 months of hair loss. A change in hairstyle may perhaps conceal 1 or 2 small bald patches. If the hair loss becomes more extensive, then the decision on whether to treat can be reconsidered. But even with extensive hair loss, there is still a chance that hair will regrow without treatment. Note: alopecia areata itself won't damage your general health, and so not treating will not lead to any general health problems. Home remedies. Ayurvedic home treatments. Collect the soft and green leaves of beetroot and boil a few in water. When the leaves become tender and soft, take them out of the water. Now grind the leaves fully to a homogeneous pulp. If water is needed, only that water should be used in which the leaves had been boiled. Repeat the procedure in a similar way, but this time replacing the beetroot leaves with henna. Now grind both the leaves together. Apply this paste over the head liberally. Allow it to dry and then wash it with lukewarm water in which a few drops of lime juice have been added. Repeat the process for 1 full month. It is expected that within this period hair will again start to sprout on the bald area. After doing this treatment for 1 full month, repeat it after every week. It is a very good remedy and many bald people have now lush growth of hair. But, as told earlier, it could be useful only when the thinning has not been due to the hereditary factor. Rub on the scalp 1 teaspoon oil in which raw mangoes have been preserved for over 1 year. Repeat this treatment frequently. Grind 1 tablespoon licorice root pieces, Malathi, in 1 cup milk with 1/4 teaspoon saffron, Kasur. Apply this paste on bald patches at bedtime continuously. Grind fenugreek seeds, Methidana, with water and apply on the head. Leave for at least 10 minutes before washing. Do it every morning for a month. Boil 1 cup mustard oil, sarson cocktail, with 4 tablespoons henna leaves, mendi, filter and bottle. Massage on the bald patches regularly. Grind the remains of tobacco smoked in a hookah, and add to boiling mustard oil, cool and store. Massage on the bald patches regularly. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies, and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination, and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva, Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. Subham.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.